having us. Thank you for your interest. Very briefly, let me talk a little bit about what we call our mindfulness techniques on day one of the program. It's an excellent program. Tom and I, we're big fans of it. As he said, we've been running it for a year now. We have a few clients that went, well, more than a few clients at this point, that went through the program with great results. And clients that decided to stay with us and continue and develop a love for boxing. Excellent, excellent results. But in any case, how many of us go to therapy, sit on a couch, talk to the therapist, go through the techniques? There's a lot of value in it, but honestly, it's not for everybody. Some people don't know how to share their feelings. In fact, a lot of people don't even understand how to understand their own feelings, which is one of our objectives in the program, to teach emotional regulation, and the first step of it is recognizing. But nonetheless, as you can see, I am excited about this program. I could talk about it for days, but I want to introduce you to a couple mindfulness techniques that we teach on day one. We do teach proper therapy, minus the sharing part, minus the couch part. We combine it into a healthy activity of boxing, getting the heart rate up, getting the healthy both mentally as well as physically. And so one of the key terms we teach on day one is mental hygiene. Just as you go to a dentist and you go through, and the dentist makes their recommendations for you for your dental hygiene, brush your teeth twice a day, floss every day, mouthwash, etc. In the same way, we bring you our mindfulness techniques and encourage you to practice, incorporate it into your own daily mental hygiene. One of the techniques we call is the grounding technique, 5, 4, 3, 2, 1, where you engage the 5 senses. And if you'd like to, you can follow me through this technique. The idea here that if you are grounded with me right now, then you will feel safe, and it's a way to defeat anxiety. Because in a way, anxiety is a fear of the future. It's misplaced energy. So if you're not worried about the future, if you're here with me right now, then in a safe space, in theory, you shouldn't be anxious. And so here we go, 5 senses. First sense being the sense of eyesight. I would like for you, I'm inviting all of you to look around and identify 5 people or items or objects around you. The sense of eyesight. All right, very good. Next, the sense of touch. So now I will invite you to touch 4 items around you, or maybe each other if you come here with a friend. Feel different textures. That's a sense of touch. Next, I would like for you to engage your hearing. Concentrate on 3 sounds around you. For example, my voice, number 1. The chatter in the background, maybe snapping fingers. It doesn't matter what. What is it? The sound. Hoorah. All right, I got you, brother. Hoorah. There you go. So 3 sounds. Next, this can be a little bit more difficult, but use your imagination. Next is the sense of smell. So smell 2 items. For example, maybe your shirt, the cologne, if you still have cologne, or the armpit, or whatever. It doesn't matter. And the final sense is a sense of taste. That is, have a sip of water, have a drink. Even if you just dry swallow or taste your own lips. Whatever, it doesn't matter. The idea here is engaging the 5 senses. If you practice this technique, you can do it in the morning when you get up to get your day going. You can do it at night as a form of calming down and getting yourself grounded in the safety of your house, in the safety of your bed and a mattress, for example. You can do it on the way to work. When you're on the highway, go through this technique quickly. You can do it right before an important meeting. Take a charge, take a hold of the environment, the meeting space, whatever. I encourage you to practice it every day as many times as you need to. And you will find, if you keep doing it automatically, that's another one of the concepts we teach on day one, is that we help you develop healthy primers. Everybody here probably knows or understands what are unhealthy triggers. Triggers are events that may send us down a destructive pathway. For example, there is a trigger that maybe makes me want to go get a drink. Okay? So we try to identify unhealthy triggers and replace them with healthy primers. This technique, the grounding technique, could be a beginning of a healthy primer for you, for example. So practice it in the morning, at night, before meetings, whatever. And the second quick technique is the breathing technique. Breathing is extremely important in general, in medicine, and in everything, mental health, physical health. And so we teach several breathing techniques during our program, and one of them we call warrior's breath. It's a good recovery breathing technique. It's a good calming technique. Imagine being in a state of anxiety, a panic attack. One of the symptoms is difficulty breathing, inability to take a deep breath. We feel like our chest is tight and closed in. That's normal. That's a symptom of anxiety. So here is the warrior's breath, and feel free to join me in it. You take a deep breath, and as soon as you think you got it, you suck just a little bit more air in to give that extra burst of energy to open up the chest. And then exhale, you do it also twice. Exhale fully, and then when you think you're done, push a little bit more air out. And I encourage you to practice this breathing technique as much as you like to, many times a day, before an important meeting or an exam, before some kind of a difficult, uncomfortable situation, or as a form of calming down at night before you go to bed, or as a form of recovering your breath after you're working out, when you're taking that 1-minute break between the rounds, for example, etc. And so with that, I'll pass it back to Tom. I hope you practice these 2 easy techniques and start developing healthy mental hygiene for yourself. Thank you, Tom.
Thank you, Oleg. So a big part of my recovery was going through the Wise Warrior program. As many of you know, I've been involved in martial arts, jiu-jitsu, boxing for the last 15, 20 years, and the surgeries that I had to undergo prevent me from doing things that I used to be able to do. So emotional regulation and being able to use something that I used to use to keep myself on edge, competitive, and in shape in a different fashion has been extremely interesting and developmental for myself. And I invite anybody that is interested in it. I have some of our books in the back, and we are going to be having an online program that you can follow at home as well. Well, with that being said, I have our next panel, which is Psychedelics in Recovery with Chelsea Byrd. Welcome, Chelsea. How are you? Doing good.
Hi, everybody. How are you? Good afternoon.
Sorry, Dom. I will let you take it from here.
All right, perfect.
Perfect.
Awesome. I'm going to have my panelists come up and join me. I think our former speaker was talking about difficulty breathing. I'm having difficulty breathing right now, so I think we should all maybe just take a couple deep breaths. Awesome. Great, so I'm super excited to be here. This is a Recovery and Psychedelics panel. And I am just gonna start introducing my panelists, and then we'll kind of get into it. So the first person that I have is Ananda. You just wanna give us a quick little intro?
Hello, good evening. My name is Ananda Blisslife. I am a Kundalini way shower, a sunshine ambassador, a sound healing sorceress. I'm here as a keeper of earth magic to speak about my experiences with guiding people back to their own source of healing, love, and power within, specifically with the use of plant medicines and mycelium allies. I'm so grateful to be here. Thank you.
The next person that we have is Keeila Ryan. She is founder of Plant Allied Recovery. She and EJ flew down from Maine. We're excited to have her today.
Hi, everyone. My name is Keeila, and I'm the founder of Plant Allied Recovery. And,
Here. Use this one. There we go.
Okay, can everyone hear me now? Awesome. So my name is Keeila Ryan. I'm the founder of Plant Allied Recovery, and I'm also a person in recovery. And I started my recovery journey in the halls of AA, practicing the 12 steps and doing a lot of service work in that area. And because of my story, because of a lot of trauma that happened to me when I was young, and other life events that really made it so that the 12 steps was not a complete solution for my recovery, I needed to look elsewhere. I had tried EMDR, I had tried all sorts of other ways of healing, therapy, and the only thing that really worked for me was plant medicines and right use and right relation with plant medicines. And so, so now today I get to show other people the way of how to find their own most healed self and how to each define their own path of recovery through plant-allied recovery.
Awesome. Thank you, Keeila. I'm looking forward to digging in. The next person we have is Dr. Joe Pullara from Inner Vision Psychiatry. Dr. Joe, just quick 2 minutes so everybody knows kind of who you are.
Thanks. So my name's Joe Pullara. I'm an adult psychiatrist. I did my training in Kansas City, where I trained under an individual who had the most successful ketamine practice in the Midwest. My love of psychedelics grew from there. During my training, I helped start the American Journal of Psychedelic Psychiatry, and that journal publishes quarterly. We have international submissions about all the different psychedelics, from LSD to psilocybin, MDMA, ketamine, ayahuasca, and I've been closely following all the research that has been coming out about psychedelics and addiction, so I'm very excited for the panel.
Our next superstar is EJ Oldak from Plant Allied Recovery as well.
Hello, everyone. My name is EJ, superstar, and I'm co-founder of Plant Allied Recovery here with my partner Keeila. And my story of recovery is overcoming numerous addictions, from drugs, porn, food, to just needing to control the world around me. And so my lens of recovery has really focused on holistic health and finding healing starting with my physical body, but then making huge strides with plant medicine. So that's what I bring to the talk today.
EJ, if you will share your microphone with Teffa, we're getting another microphone. That would be fantastic. Our next beautiful, blissful earth angel is Teffa Honan from the Church of Pachimama Munai. Teffa.
Thank you so much. Yes, my path of recovery with plant medicine has been very, very beautiful and very exponential. I came to drink ayahuasca for the first time dealing with a coke addiction, suicidal behavior, anxiety, depression, you name it, and lots of oppressed and suppressed energies and emotions from my childhood. Things that I didn't understand, never had the space to process. And I was trying many, many different things, as we all do before coming to a plant that will actually speak into the depths of our being. And the process with the medicines are very deep and transformational, and some of them are purgative, which it was my choice, ayahuasca. And it really took me out of a hole that had been for 12 years. In 6 months, I had recovered my life, my ability to work, my ability to respond to my family, my ability to be connected. So plant medicine was the right path for me.
Thank you, Teffa. And you all don't know me, so my name is Chelsea Byrd, and I have been in recovery from an alcohol use disorder for over 5 years. I did the traditional route. I went to treatment. This is my first time publicly sharing my story. And after over 7 months of treatment, I joined a spiritual 12-step program. 4 years into my recovery, I wanted to end my life. I was doing all of the things that we're told to do, and I couldn't connect to myself. And I was seeing a therapist every week and doing all the work, but I still just felt really, really disconnected from myself and from Source. I met an amazing human being. His name is Brian Frankel. He is no longer on this earth because, the stark reality of the disease of addiction, if you're struggling with it, you either die, you either go to jail, or you either go to treatment. So the success rate is pretty minimal there. But Brian, when he was living, introduced me to psilocybin, and I was scared to try it. I didn't want to be excommunicated from my community, because I think it's really important that we have a community to survive. However, I did it, and it reconnected me with like my little you. Like, we all have this inner child, but it was a really amazing journey that led me on a microdosing journey. And I remember 3 months into it, I sat down with my psychiatrist or my doctor, and she said, in 5 years, nothing has changed you, like whatever it is you're doing. So the next journey that I'll be going on is ketamine. So I'm excited to hear from Dr. Pullara, and I'll be doing that in a clinical setting. I won't be doing trash can ketamine. I'm sure a lot of you here have done that before. And I just want to welcome you to like my living room. We're kind of like a family, right? So I kind of just like got really vulnerable and shared like some stuff. Teffa, you did that too. I think like we look at recovery as like, oh, I had a hard workout, right? I can be in recovery, but like how would we define recovery? And like there's a lot of people on the sober trend, like they're not drinking. So I always like think about that, like what does that mean, and how do I accept them, and how do I not get all like, well, I've been sober for 5 years, right? So it's like, do we put definitions on that stuff? I mean, like, what do you guys think?
So really, I think it's interesting, and I love educating people about the fact that the definition, if you Google recovery, doesn't say anything about sobriety. So sobriety and recovery are not synonymous, even though many people use them in that way. And really what recovery is coming back to who we're always meant to be. And that's what these plant medicines and psychedelics can help us to do, is to come back to who we were meant to be before the trauma, the programming, before society, the addiction, everything else. And I know for me personally, you know, I was a homeless heroin and meth addict for 1.5 years of my life, and I have survived many, many traumas. And when I was in the normal recovery, I was not taking as good of care of myself. I was, you know, really leaning heavily on caffeine and nicotine and other things to propel me through life. And what the plant medicines have done is they've gotten me in touch with my highest self and allowed me to come back to center and to learn who I am without all of that, who the essence of me is. And so I think that recovery really is about returning to who we are meant to be, and really making sure that we are doing the right thing, right? Because it is so easy to slip back into old patterns. We have these deeply ingrained neural pathways towards misuse of, you know, not just substances, but also relationships and love and other ways that we can escape. And so to me, when I think about the word recovery, I really think about how do I come back to who I am without all of the noise.
Yeah. Thank you.
Yeah. I hear your story, and it sounds so much like so many stories that I've heard of individuals in recovery. One thing that I always remind patients is that there is no end date to recovery. You're in recovery every day, right? You mentioned like trying to resist urges and cravings, and just because they're not as strong as they were the first day that you stopped using, there's still, you know, you still have these internal battles all the time. And, you know, putting an end date on recovery, I think, downplays sobriety and makes it less meaningful. I think remaining sober is incredibly powerful and you know, incredibly challenging. So being cognizant of those, you know, small victories every day that you didn't use means that, you know, every day you're still in recovery, and every day you're getting better and becoming a better person and returning to the inner you that you were describing.
To add to that, I say, what does the recovery process even look like? Like when we teach the steps, it's to return to a spiritual life, looking outside of yourself, being of service, and being connected to other humans. What do psychedelic plant medicines teach us? To come to this place of connection to yourself, to the earth, to others, to be of service. And so really, and we're all in recovery, right? Like even if someone doesn't have a drug addiction, I'm sure they're addicted, numbing, or avoiding something in their life in some way. So in reality, and then it's like, what is psychedelic integration? It's doing all of these things. So really, recovery is just coming back to the essence of what I think living a happy, healthy, and joyous life is really all about.
And just to kind of hit on that point, like recovery on the broad spectrum, right? So it's like, what if, you know, there's somebody sitting in here and they're like, I don't really have a drinking problem. I have a healthy relationship with alcohol. Like alcohol, I'm going to be honest, alcohol wasn't the problem. I was the problem, because I stopped drinking and I still was creating a lot of strife, not only in my life, but the lives of other people. It was only through support and consistent practice of better behaviors that I started to change a little. But the next thing after that killed me was relationships, like romantic relationships, friendships, my unhealthy relationship with my mom, and how that just kind of trickled into everything. And then there's the process of losing somebody that I'm attached to, like, and dealing with that, and then being in like recovery from loss. So like, I don't like think of it, because I am a person in recovery, that like I'm the only one. Like, you guys don't know. Like, we've all experienced some form of trauma. But what does it look like if you're maybe like in recovery from the loss of something or someone?
So for me, I actually had this experience, and it's a part of my story that I didn't share earlier, but when I was 19, my partner committed suicide. And for me, that is something that is ongoing, just like other types of, just like addiction, just the recovery of that does take a lifetime, and it is a continual process. And so recovery is not a destination, and recovery from anything, it's not a destination, it's a process, and it's a journey, and it's something that you can fall in love with. And just to share a quick story, yesterday was my birthday, and the day before was the 10-year anniversary of my partner committing suicide. And so I had this beautiful closure, and I had also had experiences sitting with ayahuasca where I've gotten to converse with him and feel so much relief happen as a result of getting to commune with him in that way. And I would have told you that it was something that I had really overcome and really moved past. I mean, it's been 10 years, and yet 2 days ago I went to this reunion and it all came back up, and that's okay. It doesn't mean that the healing that I've done isn't valid or hasn't been enough. It's just that things continue to come up, and we're meant to continue to be in this relationship with ourself, with our psyche, with our, with everything, with the earth, and continue to grow on our path. That's that's one of the most beautiful parts of being human, is continuing to get to grow and deepen our ability to overcome and build our resilience, and and just recognizing that those types of things aren't something that's, there's any timeline of when you're meant to be over it. Grief is a process. It takes so many different forms, and really coming back to, that 10-year marker 2 days ago, I felt it all come up again. And so the process of recovery from losing someone is similar to the process of recovery of losing your addiction, because even our addictions, right, it's how we escape. We don't use because it is adding to our lives. Usually, it's really subtracting from our lives. So it's really, we have to grieve that too. We have to grieve the person that we were, and really focus on bringing that intention of how do we want to show up in the world for any type of thing that we have to recover from. How can we show up to the world today and make a difference, and really honor the human that it is that you might have lost, or honor the person that you were before, but still continue to look forward.
And to add to that, we are humans, we are like onions. We have many, many layers. And as we start to peel off the layers, we get to process different states of that same trauma or grief. Also, you process it through your chakras differently. So I also had a loss 10 years ago, funny enough. And it was my best friend who got killed in Colombia by the soccer team fans. It was something very tragic, very sad. And it shook me forever. And I found strength on sitting with ayahuasca, because I once saw the difference in the death process and was able to connect with him in spirit and understand that we are eternal, which gave me more easiness in this plane, knowing that he was okay and continuing his process in life. He's still living in a different state, might not be here. So it allows for the states of consciousness to expand, to work with psychedelic and plant medicines in the right settings, so you are not so attached to the death, but being able to receive the lessons, being able to receive the wisdom from that experience, so you can become better here and share it with others. Everything that happens in our life is for a reason. Nothing is a coincidence. Even the hardest challenges are a reason for you and your essence, for me and my essence. And now it makes me the ability to be able to hold space for that grief because I've experienced it. For 10 years, it wasn't like that. Now it's just becoming an easier topic and an easier way to see it through the work with the plant that also show us the differences of being here in the physical or being there. It's not that much. We are all spirits and can connect into that space as well.
I think it's really important to remember, like, even though we are humans, we still have a spiritual experience. I've really tried, you know, one of the things that came up for me and has continued to come up for me is I had so much unprocessed grief and unprocessed trauma because I didn't want to deal with it. I wanted to avoid it. Like, I wanted to change how I felt every time I woke up and, like, crawled over to the wine bottle. And alcohol did that for me. It numbed me out. And then when I started to get better, I looked at it like this relationship with alcohol is my most unhealthy relationship. I have put everything in front of, like, everything behind my addiction. So, like, I destroyed relationships and I destroyed anything. And the interesting thing is we're hailing 10 years, right? So 10 years ago on Monday is the anniversary of my car accident, and I got into a horrific car accident 10 years, just real quick share, shattered my spinal column. I shouldn't be walking, right? So I should be in a diaper and a wheelchair, but I just think it's interesting that there's like that 10-year connection. And I know that when I was like in my own journey down the depths of addiction, I couldn't like connect with anything, and I've heard it said before, if the disease of addiction, if the definition of the disease of addiction is being isolated, then the definition of recovery is connecting. And it's like, so if I'm struggling to connect and I use a tool such as psilocybin or such as ayahuasca to connect me with myself or to connect me with my higher power, like, how does that amplify the results of like being able to sit down? I mean, is it like, oh, I'm now going to have a relationship with marijuana because it helps me with my PTSD? Can I substitute my relationship for alcohol, or like I'm just help me? Because like once again, I'm still new to all of the this new psychedelic renaissance, and just curious if anybody has had any sort of experience like, I need to break through this, so I'm going to use this as a tool. Like, what does that look like?
I feel like sometimes that's like seems to be a reasonable way of looking at it, but I think it also kind of becomes a crutch. So I have people that come into clinic, and one of the screening questions we have is, you know, how often are you drinking and that kind of thing. And people will tell me, well, I stopped alcohol. I don't use any drugs now. I just use marijuana. And it's like, okay, well, how often do you use it? Well, I just do it just a little bit, like at night, you know, just at night. Okay, well, what does it help with? Well, it helps me eat. I can't eat anything without it. Okay. Oh, and it also, like, it helps me sleep, too. But, I mean, I'm not, like, addicted to it or anything. So, okay, so you do it every day. You can't eat without it. You can't sleep without it. But you don't feel like you're addicted to it. You convinced yourself that, okay, this is different. You know, the meth was one thing, but this isn't that bad. I mean, it grows from a tree. Or the alcohol was different. Like, you know, I was getting drunk and making a fool out of myself. But I just, you know, smoke marijuana, and it helps me eat, and it helps me sleep, and everything's fine. But the reality is that's just another substance that, you know, it may not be. You may not feel like I'm not like them. Like, I'm not like the alcoholics, or I'm not like the people using meth, or I'm not like the people using coke. Well, it's still a drug, in my opinion. So, you know, you have to be honest with yourself. There's, you know, recreational ways to use it, and that's fine. But I think when it becomes like I can't do this without it in multiple aspects of your life, it's different than, well, I just do a little bit of marijuana.
From a harm reduction lens, I think that, of course, if you are someone who is using something, you know, and there is a potential for you to OD and die immediately, and the only way to, you know, reduce that is to use cannabis or some other type of psychedelic medicine in that way, then from a harm reduction lens, yes, that is a better, safer choice. And that's wonderful. We always want people to be making safer choices. However, I would encourage a person who is struggling with this to really be honest with themselves about what that relationship is. And exactly like you said, to not delude yourself into believing that it's okay just because it's something that comes from nature. And what we teach in plant allied recovery is really all about right relation. How do we have right relation with the medicine? And it comes from a lot of different avenues, including being honest with ourselves. We have to have a deep, good internal reflection system. We have to do our shadow work. We have to show up as the beings that we are meant to be. We have to really make sure that we are honoring all of that. We have to have a reverence for these medicines too, even cannabis, right? Like, one thing I love to teach people too is to make that into a sacred time for yourself. If you are working with cannabis, how can we pause, say a quick prayer, bring, you know, the herbs to our heart, and just allow that to be a practice that is expansive to us versus something that we're doing to escape. So really the best way to navigate this is to ask yourself what your intentions are. Are you going to this medicine to escape how you feel, or are you going to this medicine to deepen and to expand and to try to show up as a better human? And to me, the path of recovery is really always when I'm trying to show up as a better human and I'm trying to work with these medicines in a good way. Another thing too is I think language is really important. It's how we communicate with the world. And so when we say things like, I got really high, or I got, you know, effed up, or whatever, you know, that's not really a way to honor and to really bring reverence to the fact that these plants have an inherent wisdom to them that we can't comprehend and can't understand, that is quite magical in my opinion. And so I really love also teaching language shifts. So even when you say I'm communing with these plants, I'm praying to these plants versus I'm using, right? Because you associate using, you know, with other things. Like, you know, to me, when I think about using, I think about heroin, I think about meth, I think about those types of things. And so when I sit with cannabis, I say words like sit with, work with, commune with, pray with, and all of that.
I love that you you work with language shifts. One of the first terms that I heard that like really made my skin crawl was the word like I'm clean, because like I respect anybody who's out there that's like I'm clean and they own that and they honor that, but I'm just like, in order to get clean you have to be dirty. And like what we have to remember here, right, is like we're all human beings having a human experience. Some of us, unfortunately, are afflicted with a disease, and it's a disease of an addiction. And people that are struggling with that, they're not bad, they're sick. They do bad things. But I mean, so my job is, I'm a clinical interventionist, so I work with people in the thick of it and their families, and I help them get into treatment. And I'm really trying to bridge the gap between this person's been to 60 treatment centers, maybe that's not working, and then talking to the family about maybe we should send them to an iboga retreat, you know, like maybe they need something a little different. And honestly, I can send them to treatment, or I can send them to an iboga retreat. If they don't do the work one day at a time, they're not gonna stay sober, or they're not gonna stay living their life in recovery. So I really try to make sure that the families know that. It's just there's so much around the whole addiction is a family disease, and being able to kind of let that sink in, because a lot of people want to point fingers at people that are struggling. Has anybody here like had any, Dr. Joe, I know you work with a lot of people. I'm kind of interested in like, what's the science behind, you know, treatment versus, you know, plant medicine versus, you know, or what have you experienced in your own practice?
Yeah, I think, you know, it kind of depends on what substance we're talking about in terms of addiction. Something like alcohol, for instance, there is some evidence that LSD in, you know, certain settings can be helpful. The founder of, I know we've talked about AA quite a bit. The founder, you know, Bill Wilson, had done LSD before starting AA. Something like cigarette smoking, there's some really good evidence for psilocybin for cigarette smoking. Much better than some of the other options that we have available to us, like Chantix or the nicotine patch or Wellbutrin. Things like opiate addiction, Ibogaine is gaining more and more popularity, more steam. I've seen more things coming out with that. That seems to be pretty promising. You know, methamphetamines is something we've talked about a bunch. That one has been incredibly challenging to get off of. I just want to say how impressed I am that you're even able to get off of methamphetamines. I do inpatient psychiatry in Lakeland, in Polk County. Methamphetamine is an incredibly widespread problem in Polk County itself. And I have a very, very difficult time breaking through with folks who are addicted to methamphetamines. I haven't seen any specific trial looking at methamphetamine addiction, but I know that it is one of the most difficult drugs to get off of. I saw a study that looked at the rates of dopamine release after you've done each drug, and they compared it to the rate of dopamine release that you get during an orgasm, one of the best natural feelings you might be able to experience without drugs, right? So the level of dopamine that you get after a hit of methamphetamine is 1,000 times more than an orgasm, and it lasts for 8 hours, or it can. So you can see how difficult that might be to try and, you know, as a provider, try and talk to someone and try and encourage them to pursue sobriety and see where they're at. I can't tell you that, you know, being sober is going to be just as good as being high. Being high is probably going to feel significantly better in the moment, right? But long term, you're not going to be feeling that well long term. So that's kind of like the approach that I try to break through, but it really, like you had mentioned earlier, it depends on what stage of recovery you're at. If you're still at that contemplation stage where you're just thinking about it, no matter what I tell you, you're not ready yet. You know, I can start to have these conversations, but until you're ready, that's when the change is really going to happen to the strongest point.
You know, I think that's great, Teffa. I'll get right to you. I wanted to latch onto something since I'm talking to a psychiatrist, right? We're talking about psychedelics. Let's touch on pharmaceuticals for a second. We're talking about methamphetamine. I know like a pretty popular drug these days is Adderall. And I've heard a lot of people say like methamphetamines and Adderall are the same thing. Well, it's kind of like saying like garbage can ketamine and clinical ketamine are the same thing. But how would you, or have you, how would you describe, you know, what like the Adderall usage and the addiction rate is? And is that the same as methamphetamines? If somebody has or even like, hey, I feel sad, I went to a doctor, they gave me a prescription for Wellbutrin. I see so many people be like, you could use psilocybin, you don't need to like be using that. And I'm not a medical professional, I'm a clinical professional, but not a medical professional. So some insight there?
Yeah. So I'm, you know, a data-driven psychiatrist. So I follow what the data says based on, you know, what we're going to be prescribing. Right now, psilocybin is making its way through clinical trials for depression. Now they're also looking at it in places like Alabama for cocaine addiction. But in my opinion, the jury's kind of still out, and I'm waiting to see how things go and how things progress. Now, there are plenty of people in the room that have had positive anecdotal experiences with these substances, but the plural of anecdote isn't data. So when the data comes out and it looks good, I will be first on board with all of this, because I think the current medications we have for addiction don't work that well. Things for like, you mentioned Adderall. If you're being treated for ADHD, you know, Adderall is mixed amphetamine salts. It's not the same as methamphetamines. Plus, when you get methamphetamines off the street, there's really no guarantee that you're even getting methamphetamines. I have people, like I said, on the inpatient unit all the time that tell me, yeah, I just do meth. Well, your drug screen's positive for meth, cocaine, and fentanyl. When you come in, they're like, well, I don't, and they get all, you know, they get mad. I don't do opiates. I'm like, well, I mean, you do drugs off the street. You don't know what's in them. They put things in them. There's this new trank drug that's popular right now because it just, you know, it accentuates the effects. The dealers don't care what effect you get as long as you keep coming back. So I think you know, we have to separate out the difference. And ADHD is a very, very real thing, and the treatment for it in adults is commonly stimulants, and people do really well on it. Now, if you go to like one of these like fly-by-night clinics, they see you for 15 minutes, you fill out a survey, and they send you Adderall, yeah, that's riskier, and the DEA is shutting those down. There was a big one called Done that just recently got shut down because there was essentially no oversight at all. and it is dangerous. It's led to Adderall shortages across the country for people, and even, you know, children, adolescents, adults that truly have ADHD, that truly struggle, you know, with functioning in their lives, now can't get it because some of these, you know, they took advantage of the COVID policies that relaxed inpatient or in-person visits and allowed these online clinics to pop up overnight with, like, you know, a nurse practitioner with, you know, 8 hours of training to do a screening. You fill out a survey, and next thing you know, you have 3 months worth of Adderall sent to your house with no oversight, really. And then they don't have to see you again for another 3 months. So they just send it to you, hope for the best. And then, you know, since you're not being seen in those 3 months, you take a dose and you're like, well, that didn't really work. Then your brain naturally tells itself, well, what would happen if I take 2? Or what would happen if I take 3? And then, well, 3 works really good. So now all of a sudden you're on 3, you know, twice a day, 3 times a day. And then you go to the pharmacy and, you know, we're out of it. And then we have to try something else. So then that's how you kind of navigate your ways to the streets. So I think it's a dangerous game out there with online ADHD prescribing.
Just to add to that too, I think it's important to remember that these medicines, you know, in any medicine that we're going to, whether it's pharmaceutical or plant or psychedelic, for addiction, it's not a total fix. Like, even if you are addicted to heroin and you go, you know, sit with a boga, or you go to an ibogaine clinic, and it physically removes, you know, scrubs your opiate receptors and resets you, and that's incredible and beautiful and a great start and something that is so needed. However, it's not a complete fix. Really, like, addiction is not just our body, right? It's body, mind, and spirit. And so if we just think, this is why medications like methadone and Suboxone don't work that well, right? Because if we're just focusing on the body, if we're just focusing on the physical parts of addiction, that's not a complete picture or a complete solution. And so focusing on the mind as well and focusing on the spirit is really important. But I love what you brought up, the Johann Hari quote, the opposite of addiction is not sobriety, it's connection. And that's really where the gap is right now that I feel, because people who go to these peer support meetings like AA, NA, it depends on where you are. There are certain communities where they're more accepting, but a lot of them are still very traditional abstinence-based. And so really, how do we bridge the gap? How do we create community for those people? And that's, you know, what EJ and I are trying to do with our plant allied recovery work. We have free meetings that anyone can attend and get that support. But we need to think of all of these things, and, you know, those meetings are also limited because they're online. They're online meetings, and we need to, as humans, our DNA, we need, it's a part of our makeup. We need tribe. We need to find our people. And so I think that when we look at addiction and the potential for these medicines without also looking at the community aspect and the mind and spirit as well, it's not a complete picture.
Yeah, I agree with that. In our culture, it's people want to take a pill and have it fixed. But that's not how plant medicines and these allies work. I see these medicines not as just physical medicine, but frequency medicine, energetic medicine as well. And when we're working with them, we're inviting them into our bodies as allies. They're life forms, they're frequencies, and we invite them in as allies to remind us how to heal ourselves. So plant medicines are not going to be a quick fix, but what they're going to do is open your channels so that you can begin the healing process. Remind ourselves that we're the earth. Remind ourselves we're connected to community, that we have this support, and clear out those blockages so that we can come back to healing our own selves.
Yes, and plant medicines are the pathways for a lot of the healing on the addiction, because it takes us into spaces where we can process what happened. Many of us become addicted based on something that happened. It was not the substance what made you addicted. It was the situation that you were experiencing before deciding to take the substance, and then you continue to do it because it's too hard to look at, it's too overstimulated, and you're not being able to process the emotion. But the plant holds you as an ally, so you can process that emotion. Specifically with ayahuasca, we've seen great recovery from meth addiction and heroin addiction, because we're able to hold that frequency for them to deal with whatever was causing, if it was sexual abuse, violence, whatever happened in their lives. And then we create communities so we can hold each other accountable, and we can hold each other in love, so you can continue your process of connecting with yourself and resolving your trauma. Many of the medications that we take here in the Western world are suppressing your emotions. They don't want you to open up. The plants actually trigger you and open you up so you can get them out of your system. And for the weekend may be very overstimulated to be there, just like, oh my God, I'm looking at it. But then you get the refresh, and the fresh of breath of air are going to allow you to look at things with a slower pace, with a more regulated nervous system, where you can process and heal and recover, not suppress and run away and just take the pill and see what's going to happen in 6 hours. So plants are made by God. They were sent by God here to support us and guide us. And sometimes the plant is going to become the path into the recovery of the person. And for sometimes it may seem as a replacement, but hopefully they're working with facilitators and people that will guide them into then letting go of that. And here is another tool. Here's a breathwork tool. There's a yoga tool. Here you can ground for 30 minutes. Here you can do all these other things that are going to take you into that state of connection and relaxation that you're looking for. Now, not with a substance or an ally, but from within, with your breath, with your spirit.
Yeah, so I'm EJ, I think you had something to say, so go ahead.
I'm so excited to hear you start talking about this, because for me, I was someone that looked so deeply at my physical body and was using all these tools. I was so in all of it, the meditation, breathwork, yoga, exercise, diet, just everything I could possibly do to be as healthy and theoretically as happy as possible. But because there was so much that was suppressed that I didn't even know about. Like, I could have done all this stuff for my whole life, and I don't think I ever would have gotten where I truly wanted and needed to go without plant medicine, because it created a space for me to open up and heal things that were so deep inside, and creating physical dis-eases in my body. I was doing everything I could to be so healthy. I still had chronic pain. I still had IBS, and it was plant medicine that finally let me open up and feel and start to release these things that have been buried in from my life and the lives of the people before me as well.
EJ, what was your breaking point
In what?
in that journey that you were just telling us? Because I know you're from Maine. We're in St. Pete. So St. Pete is like this hippie mecca, and I love it here. It's like a mini Los Angeles. But once again, I'm not dogging anybody out, but we have so many people that are like, I'm going to do breath work and then a cold plunge and then go to the gym and then meditate and then yoga. And I'm like, oh my God, you're so busy. Like, when have you ever taken time to stop and feel your feelings? And some people are going to live like that their entire life, and maybe they'll be happy, maybe they won't, but I feel like maybe you're running from your feelings, and I don't know because I'm not in your body. So I'm like, you were doing great, but you were doing all this stuff, something didn't feel right. When did you break? Or were you just like, this was my journey, I started connecting with plant medicines, and through my connection with the plant medicines, I was shown that, like, this is not how you live?
That's an amazing question, and you totally described me and called me out as well.
Man bun. It's the man bun. It gives it away.
Yeah. There was no breaking point. I was certainly doing everything at every moment, and honestly just constantly getting sick because I was doing so much and never finding stillness. And I wouldn't say there was a breaking point. It was just the journey and slowly being drawn to different things and being shown different ways of being. And to be honest, that was just the path, and it was necessary for me at that time. And I think I'm just so lucky to have, through connection and community, have it modeled for me, or see other beings that were more healed than me. Not that that's a comparison or competition, but my soul knew I wanted to be like them. They had something I didn't have. So then by interacting in these communities, then doors open to work with medicine and just slowly build towards a new way of being, which ultimately the being is what gives us the fruits. It's not what we're doing. So.
And I think that, like, you know, in our society, in our culture, like we live in a microwave society, so I want what I want and I want it yesterday or instantly, which, I mean, I don't know if you've ever had ramen noodles versus like homemade ramen noodles, not the same, right? And then also, we have options here. There's so many choices, like food or jobs or whatever, so essentially you can do and have whatever you want. So when it comes to recovery, right, there's always been like the traditional way, like follow this list, read this book, do this thing, believe in this God, and like you will be fine, but just do it one way at a time. Whereas there's the more like actual natural, like old school like way, which is like, hey, if you lean into this plant medicine and you listen to yourself and you follow your intuition, your internal universe will start to open up. And I don't think either way is bad or wrong, but I have had my own experience with, and I have had heard people share their stories about, I went this route and I felt shame. And my question is the shame coming from external resources, or is it something that's lingering from inside? And like, how do people address that?
Really quickly, I just want to touch on something that you just said, and I think it's important to recognize that there are multiple pathways to recovery, and that many different pathways of recovery claim that they're the way, and that's the only way, you know?
Sounds familiar.
Yeah, and I think it's important to recognize that plant medicine isn't for everyone. Even if everyone here who's probably at this space has been deeply touched by plant medicine, I don't believe that just anybody should be working with these plants. I think that, you know, you should be called in some way, and so, yeah, just sharing before we touch on that